I'm a gastroenterologist, Bertrand Napoleon, working in France in a private hospital called Jean Mermoz. I'm a specialist in diagnostic and therapeutic endoscopy, especially in the biliopancreatic field. The co-investigators of the study were gastroenterologists from private and university hospitals from France and two pathologists. The title of our article was Needle-Based Confocal Laser Endomicroscopy of Pancreatic Cystic Lesions, a prospective multicenter validation study in patients with definite diagnosis. We did this study because, as you know, there are more and more incidental pancreatic cystic lesions that are identified due to an increasing use of CT scans and MRIs. The diagnosis and therapeutic management of large, single, non-communicating pancreatic cystic lesions represent a major issue for clinicians and essentially rely on endoscopic ultrasound fine needle aspiration. Nevertheless, the USFNA is suboptimal because of a low sensitivity of cytology and an insufficient specificity of CEA titration. The consequences for the patients can be serious, with inappropriate surgery or follow-up. Needle-based confocal laser endomicroscopy, also called endomicroscopy, enables the observation of the inner wall of the cyst during an AUSFNA procedure, just as if you were looking with a microscope. You have very nice videos, if you're interested, combined with the manuscript. Several studies have described criteria for the characterization of the most frequent types of pancreatic cystic lesions, but no large multicenter study has confirmed the performance of endomicroscopy. So the primary aim of our study was to prospectively validate the specificities of endomicroscopy for the diagnosis of non-communicating cysts using surgical histopathology or AUSFNA cytohistological analysis as a reference standard. These secondary aims were to compare the diagnosis performance of endomicroscopy with that of AUS and CA analysis for differentiating mucinous from non-mucinous and premalignant from benign pancreatic cystic lesions, and to evaluate the technical aspects and safety of the procedure. Our study validates that endomicroscopy has excellent diagnostic performance that surpasses that of CEA and EUS. In our study, the sensitivity and specificity of endomicroscopy for the diagnosis of serous cystadenoma, mucinous lesions, and premalignant cysts were excellent, all greater than or equal to 0.95. Thus concluding that endomicroscopy should be considered in patients with indeterminate pancreatic cystic lesions to ensure a more specific diagnosis in order to avoid inadequate therapeutic decisions. The next steps consist of evaluating the impact of endomicroscopy on the therapeutic management of patients with indeterminate pancreatic cystic lesions. Thank you for your attention.